Okay, men, we want you to listen up. September is Prostate Cancer Awareness Month, and according to the most recent cancer statistics, it is estimated more than 160,000 men will be diagnosed with prostate cancer in the U.S. this year. Dr. Kevin Bigelow, a urologist, and Dr. Rick Miller, a radiation oncologist, are here from Ironwood Cancer and Research Centers. Great to have both of you here. So what is the prostate, Dr. Bigelow, and what is its function?
Well, first of all, thank you for having us here. That's a really good question. The prostate is a little structure that sits right underneath the bladder. It's actually really important for fertility. Unfortunately, by nature of its location, it can cause some urinary problems later in life. And the real reason we're here today, unfortunately, is an organ that is at really high risk for prostate cancer later on.
Right. And Dr. Miller, what are some of the steps that we and men should take to promote prostate health?
Initially, seeing your physician is very important. As we get older, we can have some urinary changes, and there's also family history in this disease, which is very important. So men with a family history need to be seeing their physician and just bring up the subject and talk about it.
Right, and we just gave those statistics. Understanding how prevalent prostate cancer is also very important, right?
Yeah, somewhere in the neighborhood of 1 in 10 men, maybe 1 in 9 will have prostate cancer in their life. So it's very prevalent.
It is prevalent. And what are the treatment options for prostate cancer there at Ironwood?
There's a number of treatment options that are available. Typically, we talk about surgery versus radiation. Surgery is now done minimally invasively, typically with a robot, which allows this to be a less invasive procedure in the sense of it's something that allows men to recover a lot quicker, which is very important. They usually do not need to spend a lot of time in the hospital, and they can get back to their normal just quality of life in a much quicker fashion than they would typically with an open surgery.
Right, and what are some of the tips that you guys have for men who are watching there at Ironwood? What are some tips to healthy living after treatment?
Most of the treatments with surgery or with radiation, the recuperation is very good, so you can get back to a normal life. So we recommend continuing to follow up with your physician. There are some monitoring tests that are done afterwards, but just returning to an active lifestyle. Men should expect to be able to return to their normal activities, hiking, being very active, and that promotes a healthy lifestyle.
Absolutely. Did you talk about the radiation options and the treatment?
We didn't, but it's an excellent option for men who either are a little bit older or aren't surgical candidates, or who just choose to have radiation. And those treatments are given once a day. They take about 10 or 15 minutes to get. They're outpatient treatments, and most men can continue all their normal activities while they're going through the radiation.
All right, there's a lot of ladies watching this morning who are saying, I have a hard time getting my husband up to the doctor to get their PSAs and all of those important things. When do men need to start getting those PSAs checked, and how often?
Men who have a family history, so a father, an uncle, a brother, probably need to start in about age 40. Other men sometime between the age of 50 to 55, and much of that should be discussed with your physician, but screening is a very important part of diagnosing prostate cancer.
And you said if there's a hereditary, if it's
Absolutely.
in your family.
There's certain high-risk populations, patients with a family history, African-American patients are at slightly higher risk as well. And so it's very important for them to go see their doctor, talk about this, and certainly any men with any kind of urinary symptoms whatsoever should be talking to their doctors.
And that's a yearly test
that's a
they
yearly
need to do.
test.
And
That's
very
correct.
quickly, can you prevent prostate cancer?
Not absolutely. We certainly do promote healthy living, which is something the show does a lot of, alrighty, eating well. But the most important thing, honestly, particularly for men out there, is go see your doctor. Talk to your physician, alrighty, about prostate cancer health and prostate cancer screening.
All right, let's give you some information. Ironwood Cancer Research Centers, they are located at 695 South Dobson Road in Chandler. To book your appointment, 480-821-2838, or visit their website, ironwoodcrc.com.